volumes, doing as many as 200 procedures a day. For comparison, other doctors we talk to do about 200 per week. When you say 200 eyes a day, how many is that an hour?
That is approximately 20 an hour.
That's 6 minutes per patient.
Right.
3 minutes per eye.
Right.
You make it sound like an assembly line.
Well, unfortunately, it can sound like that, but clearly our intention is not to provide that type of service.
Dr. Jan does not screen his own patients for LASIK. Stacy Simon is sent to an optometrist in Manhattan. The technician there measures Stacy's pupils.
9 millimeters.
9 millimeters, among the largest possible. But one thing they don't check is the thickness of Stacy's corneas. According to our experts, a crucial measurement for LASIK. The owner later told Primetime they never check corneal thickness. He said it's up to the surgeon to do more thorough testing. Several weeks later, Stacy shows up for her operation with Dr. Jan. She asks if she can speak with the surgeon.
Hi, I'm Dr. Jan. Please have a seat.
Stacy wonders about possible complications. The doctor says there are risks with any surgery, but with LASIK, they're very low. And he says her chart looks good.
So based on that, you're a great candidate.
I'm a great candidate. Okay.
Stacy is now near the front of the line, and the doctor asks if she's next.
No, I had 4 people in front of me.
Well, we'll see you 4 people later.
But just before she's called for her operation, Stacy wants to speak with Jan one last time.
There are some people that cannot have it done because of certain reasons, like if your corneal thickness isn't sufficient.
Okay.
But in your case, your degree of nearsightedness is not high enough for us to be concerned about that.
So basically, I'm a good candidate.
You're a good
I just
candidate.
need you to reassure me.
That's okay. That's okay. That's what I'm here for.
After that, Stacy leaves the clinic. We showed our hidden camera footage to our expert doctors, Soloway and Dello Russo.
It's shocking. It's just unbelievable.
What would have happened if he'd gone ahead and...
She would get corneal grafts. Have to have every cornea replaced.
She would have had to have a corneal transplant?
Yes.
We now thought it was time to talk with Dr. Jan, who told us he's done more than 10,000 operations and never had a patient whose vision was hurt by the procedure. Along with that lower price, are your patients getting a lower quality of care?
No, they're not. Absolutely not.
No shortcuts.
No shortcuts.
He said all his patients are checked for pupil size and corneal thickness. Of course, we know that in Stacy's case, they never measured the thickness of her corneas, just 435 microns. Dr. Chan, let me pose a hypothetical for you, okay? We asked him about someone with Stacy's exact eye measurements and whether he would operate on the patient. Good candidate for LASIK?
Probably not. There are some red flags there for LASIK.
Red flags?
Yes. In that particular case, the 435 microns is too much of a red flag. I don't think I would.
Okay. The reason I asked Dr. Jan is because we sent a woman to see you a couple of weeks ago named Stacy Simon. And you told her that she was a good candidate and you were moments away from operating on her.
Okay.
Those were her eye measurements.
I see. Interesting. I would have to, review the chart.
Jan said he would have told Stacy about the risks before operating on her.
That is a particular case in which we would have sat down before the procedure and talked about it.
Well, I have to tell you, that's not what happened, sir. You told her she was a good candidate, and you were ready to operate on her right then and there. To prove the point, we played the tape of Stacy's hidden camera visit for the doctor.
I'm a good candidate. I just need you to reassure me.
Astonishingly, now Dr. Jan reversed himself, saying that as long as Stacy was informed of the risk and was still willing to go ahead with surgery, he could operate on her safely. Dr. Jan, I am completely confused. A few moments ago, you told us it would be too great a risk to operate on somebody with, as you put it, all those red flags.
Yes, I understand your point. I'm pretty confident, 99.5% confident she would have done well. But the issue of the glare and halos, these are issues that...
So you're saying now that if you gave her the straight story about her eyes, problems, that you would have no problems going ahead and performing this surgery?
Exactly.
But we found many patients who say they were never even given that choice, who were never told by their doctors they were bad candidates for LASIK. Jeff Hockman says the result can be trading a nuisance for a lifetime of misery.
This is not the no-brainer that everybody seems, to portray it as. There are risks and there are trade-offs. And the downside is tremendous because the quality of your life definitely worsens.
Before you have laser eye surgery, the experts say get a second, even a third opinion. And don't hesitate to ask your doctors how long they've been doing the procedure and whether they'll see you before the day of surgery to study your eyes. There's more on LASIK surgery at abcnews.com.